Hi, I'm Dr. George Cosmides, and I want to spend a few minutes and talk about exercise intensity and duration. So, we've all exercised in high school, college, before the age of 30, and we've done some things that we possibly may regret. The problem with exercise is we have to look at the impact to our joints versus the benefit to our cardiovascular system and our muscles. So, things that I do not recommend patients do is any type of jump, step aerobics where there's a constant up and down or a pounding motion. Again, this will get the heart rate up and challenge the cardiovascular system. We have to understand at what price. If it's going to damage our knee joints, damage our ankles, and damage our hips, it doesn't make a whole lot of sense. Where there are a plethora of other exercises that can stimulate the cardiovascular system, challenge our heart rate without putting undue stress on our joints. Because remember, these joints have to last us 70, 80, 90, 100 years. Now I'm now 50 years old. So I realize now the importance of exercise and saving my joints. I didn't 10 years ago, but I certainly do now. Duration. After reading the research and practicing several different techniques for the last several years, I believe in high intensity, again, not high impact, but high intensity, short duration, no longer than 40 to 50 minutes, and no longer than every other day. There's a few reasons for that. We have to give the body time to recover. Remember, exercise is a trauma. And what the body does is it takes that trauma, rebuilds and repairs with the proper nutrition and rest, and builds back a little bit better. The most extreme example of that is a bodybuilder. They get those muscles because they've traumatized, they've slept, they've ate, probably done some other things in some cases, but they grow more muscle fibers and more density and so forth and so on. And that's what all of us are trying to accomplish, but not to that extreme state in most cases. So we talked about duration, no longer than 40 or 50 minutes, no more often than every other day. Intensity. I believe in high intense exercise. You want to do a few things. By the high intensity, you're putting stress. Remember, not joint stress. And I need to make a whole separate program just for anti-aging and exercise, but not joint stress. We want to stress the muscle fibers because when we stress those, the mechanism of fight or flight kicks in and releases all kind of wonderful hormones, anti-aging hormone, growth hormone, IGF, IgA, all these wonderful hormones that heal us and keep us youthful and young. The problem is a lot of the techniques that are out there, a lot of the boot camps and 90X programs do that, but at the price of putting a lot of stress on the joints. So usually those programs, you don't see someone in their 40s or 50s, you see someone in their 20s or mid-30s doing them because if you're like me, you've already have some joint damage, so you can't afford to do that for the benefit of the growth hormone release. There are some other tips. Exercising on an empty stomach is best. There's some other key tips, and I'll address those with your questions in other videos. If you're interested in my anti-aging program, please subscribe and leave a comment. Anti-aging program. I'll have your name put into that list, and I'm working on it feverishly now. I just want to make sure when the program does come out, it's excellent, it's results-driven, and the person winds up in better joint and cardiovascular health than before they started. So I hope that answers your question on exercise, intensity and duration, and exercise you want to eliminate. I'm Dr. George Cosmides. Thank you for watching. Please subscribe and ask your questions. Okay, bye-bye.